Hi, I'm Mary Thomas, physical therapist in Dallas, Texas, and developer of the Body Power System. You can move better. So I wanted to share with you a little bit today on how to work on scar tissues and how to address those. First of all, let me say that scar tissue is not necessarily just on the outside of your body. In fact, it's never just on the outside of your body. We think it is. Or I've even had patients say to me who were, hit really hard with something, and I'm like, oh, you have some scar tissue inside your abdomen, and they're going, no, I don't. Or they have scar tissue inside their shoulder joint, and they're like, no, I don't. Yeah, you do. Just because you didn't have surgery and just because you can't see the scar tissue on the outside doesn't mean that the tissue underneath didn't get scarred. So, what is a scar? A scar is where your tissue goes, oh my gosh, we got to get stronger, we got to get better, we got to get bigger because we had an assault. And so it literally forms this webbing and lays down, and you can even get layers of tissue that are supposed to move like this, but they don't. They get stuck to each other. So when they get stuck down to each other, you can't move. It limits your movement. And you don't even realize it because the scar tissue's on the inside. So I drew a scar on me. Yes, I have had 20 surgeries, but I have had them in places I'm not going to put on YouTube or any place else for social media and the world to see. So this is a family video. So we're going to just look at my scar that I drew on my knee, okay? Because I do have one on my foot, but I'm not going to, that one doesn't show up very well on camera because I've done this work on it and it's not very visible at this point. So I drew one. And these are commonplace that people get surgery. So that's why I was like, I'll just do it this way. So there are a couple of things you want to start checking with. You want to slide that scar up and down. Now again, I've already told you this isn't a real scar. It's a Sharpie. But you can even see there's a little less glide on this side than there is over here. You can see the skin, I think, slide, and you can see how that line moves on my skin. Over here, you see there's less movement, even coming up into this area. So there's a little bit more tightness on this side than there is on that side. So in a scar situation where somebody really has the surgery, the difference may be tremendous. So how do I want to address that? One, I call the star pattern. So this is my tighter area. So I'm just going to go like I was drawing one of those stars in elementary school in the different directions. Now, you're starting to get to know your body and your tissues and how they move, right? And so you go, oh, my tissues do not want to go in that direction very much. I mean, there's no pain, but it kind of just gets really tight there. But they love going in this direction. So I may even use my other hand and help them go over here. So I take them over to the side and I just hold it there. I don't yank on it. I don't pull on it. I don't try to stretch it like crazy. I just go, oh, it wants to go in that direction. So that's a feeling that you get as you're doing these things, that it's like, it wants to go in that direction. Our tendency as people is to say, oh, it's tight here, I better shove really hard. But the truth is our cells are not a whole lot different than we are. And when we get pushed in a direction that we don't really want to go, what happens? We don't want to go there, right? And so as a result, we're resistant to that. But when I am led in a direction that I want to go, I'm supported, I'm encouraged. And then I'm just allowed to be there and experience that place. Just like what I'm doing with my tissues right here on my knee. And it kind of lets go and starts to move a little bit. Now, it's not a huge amount of movement. When you have a real scar, it's going to be even less probably. And that's okay, because you're just going to encourage and support. So you see, if you're watching my fingers, how I'm just kind of following where my tissue is taking me. So again, when you're new at doing this, it may take a little bit more practice before you can just follow your tissues like I just did. However, if you trust yourself and trust your body and just follow where it goes, you will find that you can start releasing that tissue. And it will start moving with greater ease and comfort, because now you can see there's even more movement in that line. And I don't even have a real scar. So, sitting and watching TV, but you want to pay enough attention to what you're doing so that you can follow the tissues. Again, I'm Mary Thomas, physical therapist, developer of the Body Power System, and I can't wait to help you feel better.